The Pathfinder Award is an award that Prostate Calgary presents to individuals who have made a significant contribution to the education, treatment, and research of prostate cancer. Since its creation in 2014, we've had the distinct pleasure of recognizing many accomplished people in a variety of fields, all of whom have made contributions to men and their families along their cancer journeys. The 2023 Prostate Calgary Pathfinder recipient, Dr. John Lewis, is a scientist, researcher, entrepreneur. John holds multiple titles, including Professor of Oncology, Alberta Cancer Foundation's Frank and Carla Sajonki Chair in Prostate Cancer Research, and the Bird Dogs Chair in Translational Oncology at the University of Alberta. John's professional background is no secret, but did you know? He's also an Oilers fan. Tough crowd. In spite of this handicap, he played a significant role in uniting researchers, clinical trial people, nurses, universities, biobanks, and commercial partners from across the province. And if that's not enough, 10 years ago, he led a team to create Alberta Prostate Cancer Research Initiative, otherwise known as APCaRI. Its goal is to build a world-class translational prostate cancer research and training program. Since then, APCaRI has grown into a multidisciplinary group of more than 200 prostate cancer scientists, physicians, trainees, and healthcare workers. They come from 5 Alberta health research institutions working with an international network to achieve the transitional research goals. This is absolutely having a meaningful impact on health policy and the outcome of patients living with prostate cancer. In 2021 issue of the Alberta Cancer Foundation's Leap magazine, Dr. Lewis was called a research rock star. And it's no wonder, because ResearchGate credits him with close to 250 publications and 5,200 citations. He is the founder, CEO, or Chief Scientific Officer of 6 spin-off companies based in Edmonton, Seattle, and San Diego, and you'll see his tan later. They are researching and developing treatments for cancer and infectious diseases and age-related diseases. In 2017, he co-founded Nanostics Precision Health, which has developed a novel platform technology to decipher messages carried from extracellular vesicles. This has allowed them to develop a test called Clarity DX Prostate, which accurately diagnoses clinically significant prostate cancer from a few drops of blood. This test has recently been fully validated, and in July this year, Prostate Calgary was proud to support the adoption of Clarity DX Prostate in Alberta as a test to better understand and inform patients of their risk of clinically significant prostate cancer, so that the patient can discuss with their healthcare team if a biopsy is right for them. One of our members recently shared a story with me about being invited to his first Alberta Prostate Cancer Research Initiative Symposium 7 years ago. Here's his story. I walked into this room looking for someone I might recognize of the 40 or so people who were there. Perhaps I looked really lost, but I wasn't in the room for more than 10 seconds when a man came to me introduced himself, called me by name, and welcomed me to APCaRI. I soon understood how he could know me without ever having been introduced to me. He knew everyone else in the room except me. John Lewis couldn't achieve what he has done without having an incredible skill set, but also a wonderful and welcoming personality. Lastly, I want to share a note I received from Dr. Desmond Pink. Some of you may remember Dr. Pink, who was presenting to us a couple months ago. Desmond writes, "As John accepts this award, please pass along my congratulations. Work in the Lewis Lab encompasses innovative science as well as pragmatic approaches that try to encompass standards of care and benefit the patient experience. In the last 10 years, John has provided a work environment that was evidence-driven, rewarding, and challenging. None of us have had the same day twice. With the current teams, I have worked the longest with John, and each day I'm still excited to go to work." And that was written to me by Desmond Pink. It's our honor to recognize John Lewis as Prostate Calgary's 2023 Pathfinder. And now, John.
What an incredible introduction. Wow. There's like 50% of those facts I didn't even know about myself. It's been an incredible journey over the past few years. And so I just want to share some of the, just the journey we've had over the past few years. And some of the, it's really been an amazing experience. So I moved to Alberta in 2011 from Ontario. The northern part of Alberta, I'm sorry. But I think one thing I noticed when I first moved here is that the attitude here is completely different than anywhere else I've ever been. Everybody's very much, it's like a can-do attitude. It's like, what do I need to do to get to where I'm going? And I really appreciate that. And you may not all realize this, but the attitude is very similar between Edmonton and Calgary. You don't see eye to eye on everything, but it was really my goal from the very first day to bring everybody together in this province to try to make an impact on prostate cancer. So I want to spend some time today telling you the story about how we've actually done that and how all of you have participated in that journey. So this is a picture of me 7 years ago. So the first talk, so I came down to Calgary. I was a newly minted chair in Edmonton. Came down to give a talk to the prostate group in Calgary. I look a little bit different. So at that time, I think I had 7-year-old twins, and they were 3 months old, and I literally had not slept in 3 months. So I opened this talk by, if I say something that doesn't make sense, I haven't slept in 3 months. And so fortunately, 7 years later, I've got some sleep. It's great. Not much more, but a little bit more. Anyway, I'm happy to say that my twins are now 7 years old. It's incredible that how quickly they grow. Okay, so I have the best career, the best job I could have ever imagined, because the opportunity we have in science to learn new things and to make an impact is unprecedented. I actually presented this slide 7 years ago. This is exactly the same slide, and it's all absolutely true. So we're living in this world where we're learning exponentially new things every day. We understand the way cancers form and develop better than we ever have. We now have computers that can, it's funny, I have machine learning here. Machine learning is everywhere now, right? So we have computers that can interpret very complex biological data and detect patterns that allow us to make key clinical decisions that affect patients' lives, which we haven't been able to do, that's unprecedented now than ever before. And also we'll be able to design, personalize, and engineer cancer drugs that can have an impact on individuals. Because as we learned, every single person is different. our genes are different, our proteins are different, our cancers are different, and the way we need to treat our cancer can potentially be different to see a good outcome. The way we're able to now look through the body and see how cancer is progressing without very invasive tests or surgery is unprecedented. And now we can design nanotechnology, so little machines that can go inside the body and have a dramatic impact on the way cancer is treated. So again, we're in a world of personalized medicine, early detection, and better treatments to really make an impact on cancer. But I'm a scientist. I'm actually not a physician. So I have a PhD, not an MD. And in the lab, we study the basic underpinnings of why cancer forms. What's happening on the biological level, what's happening in cells. So we may spend 10, 15 years trying to learn something new about, say, a gene that causes cancer, makes the cancer worse. And so we'll have a novel concept. I'll talk to my graduate students. So Leanne Willits is here in the room. She was she's got a PhD and worked in my lab for many years on these questions exactly. And you may take, 5 years, 10 years to sort of figure out, okay, is this gene actually having an effect on prostate cancer? And if in the very fortunate case you find something really interesting, then you say, okay, that's fine. Let's take a drug into clinical trials, and then for men who have prostate cancer, it'll be potentially tested on them if they have no other options. And then every once in a while, that treatment works perfectly, works much better than any other treatment that's out there, and is incorporated into clinical practice. But we assume that this happens, but it's a very, very difficult thing. It takes a lot of years, a lot of efforts, a lot of people working late nights, weekends to make it happen, and it's very expensive as well. And so we built. So when I came to Alberta, some almost 12 years ago now, our goal is to make an impact on patients. So how are we going to complete that circle and do research in the lab that'll actually have an impact? And so my laboratory has been interested for many years on what makes cancer spread. So many cancers like prostate cancer, breast cancer, colon cancer, solid tumors we call them, they are almost completely curable if they stay put. So if they stay in the prostate, stay in the breast, stay in the colon, surgery, radiation, whatever other treatments we have can cure them. As soon as they escape, as soon as they move somewhere else, prostate cancer goes to the bones, it goes to the soft tissues, goes to lymph nodes. As soon as it spreads, it becomes extremely difficult to treat, almost an incurable disease. So my lab has been focused for many years on how do we detect the spread of cancer earlier, and how do we develop treatments that can block or cure metastatic prostate cancer. So we've been working on that very diligently for many years, but we realized if we came up with something groundbreaking, how are we going to actually move that into something that's useful for people? And so we did two other things. So we created the Alberta Prostate Cancer Research Initiative. And this group is actually great. So this is a group of physicians, clinical trials folks, nurses, everybody in the continuum of prostate cancer research and care. And the idea here is that we can take discoveries made in the lab and move them through the clinic and into patient care. But we also have conversations with physicians who are seeing patients every day who have cancer, and making sure that the questions we're asking in the lab are relevant. Like, does this matter? If I discover something important, will this impact patients? And so the Alberta Prostate Cancer Research Initiative has been really helping us define questions that are most important to answer that will actually have an impact. And then the third thing that we've done is that when we have a discovery that the group has done as a whole, we can't expect, so we publish a great paper. It's in Nature, it's in Science, and all these great journals that scientists get praised for. I get a promotion, whatever, get a raise. But honestly, a printed paper does not have any impact whatsoever on people, on patients, on clinical care. So it was really important for us also to build value in these new discoveries by spinning off companies. And so So this has been a bit of a controversial aspect of my career, is that I've had an academic career where I'm asking questions about cancer, but also taking discoveries and moving them into companies so we can create a product that can actually be used in people. And so this has created what some people call a conflict of interest. I like to call it an alignment of interest, because our goal is to positively impact patients. And so we've created several companies, and these companies have now taken things all the way to the clinic, which I'm extremely proud of. I'm going to tell you a little story today about one of the things that we've done that is now available in Alberta. So first I'll talk about APCaRI. APCaRI is the Alberta Prostate Cancer Research Initiative, and the goal here is to basically bring together not only the researchers like me who work in a lab, the physicians, urologists who work in the clinics, medical oncologists, radiation oncologists, nurse practitioners, clinical trials folks, basically everybody in the continuum of both research and care, to really focus on discussing what's most important, what people are seeing in the clinic, what are the key questions that we need to answer. And we paired this with developing a network of clinical teams. Because in Alberta, we have a unique situation that's almost unparalleled in the entire world. So Toronto can't beat us, Michigan can't beat us, LA can't beat us. We have 4 million individuals in a single province under a single healthcare system, all tracked together. And so we've been able to build 4 clinical teams throughout Alberta that capture every single new diagnosis of prostate cancer. And we're able to collect and integrate them into our clinical trials and follow them over many years to create the world's largest biorepository of prostate cancer diagnoses in the world. And we've done that, so it's really important. Obviously, if you want to ask a question about can we diagnose prostate cancer earlier, or can we diagnose a prostate cancer that can benefit from a specific treatment earlier, you need to have the data. You need to have the information. You need to have the blood. You need to have the urine to be able to ask questions in the lab and answer those questions in clinical trials. So we created this biorepository that's unparalleled in the world. We've recruited over 15,000 men in Alberta. We have hundreds of thousands of biosamples that we can not only test ourselves to answer questions about new clinical tests, but also send around the world if somebody has an interesting question or a novel technology. So really, and we were networked with 14 different countries around the world through Movember, and hundreds of institutions, so that we can pool our data together to really generate really clear answers about the questions we're asking. Okay, so I'm going to tell a little story about how we developed a novel screening test for prostate cancer that's now available in Alberta. And we start with a slide that I've given in every presentation I've ever given when I talk about prostate cancer. And prostate cancer is really a numbers game. So prostate cancer is kind of known as that disease that you can die with and not of. And I want to tell you today that that's actually not quite true. So prostate cancer is 36% of all newly diagnosed cancers, 10% of all cancer deaths in men. When you look at every 100 men in the population, about 16 will be diagnosed with prostate cancer in their lifetime. Okay, so that's a modest amount. But we know from rapid autopsy studies that if we look at the prostate of men who are 70 or 80 years old, they have like an 80% chance of having prostate cancer. So there's a lot of men walking around with prostate cancer that don't know it. And that's fine, because they died of something else. What we really need to know is who dies of prostate cancer. And actually, 3 of every 100 men will die of prostate cancer. This is a significant number. Unfortunately, we really don't have a great idea of which 3 men will die. So that's really been a focus of my lab. So if you look at, and I mentioned this earlier in the talk, if you look at who dies of prostate cancer that, actually no man has ever died of prostate cancer that stayed in their prostate. As soon as it spreads, it becomes a deadly disease. And prostate cancer, as I said, spreads to the lymph nodes, spreads to the bones, spreads to the soft tissue. And so the average survival rate in North America for prostate cancer that stays in the prostate is like 100%. It's like 99.95%. And we treat it really well here. We detect it really well. If it spreads or becomes metastatic, this drops dramatically to 30%. And that's in North America, where we have aggressive treatments. Many other countries, that's like 7, 8%. So this becomes a very difficult to treat disease. And our current diagnostic tools, until recently, do not predict whether metastasis will occur. And our current treatments, although they're dramatically improving, do not prevent or cure metastatic disease. So again, let me tell you the story about in the lab, how we started with an idea and ended up with a product. So how do we currently screen prostate cancer? I think everybody in this room has a pretty good idea of how we do that. The prostate-specific antigen was discovered in the early 80s, was implemented in screening programs across the world in the mid-80s, and had a dramatic impact on the number of prostate cancers detected and treated. And you can see here the detection rate. There's this huge bump, right? In the mid-80s, when we started using the PSA test, we diagnosed a lot of aggressive prostate cancers that had been previously undetected and had a dramatic impact. Although once those were all detected, then we continued to use the PSA test to detect prostate cancer. And you can see down at the bottom here, we see the mortality rate. So this is deaths due to prostate cancer, decreased over time because of PSA screening. And the story in Canada is actually pretty dramatic. So anybody guess where PSA screening started? It's pretty easy to understand. As soon as we started PSA screening for prostate cancer, deaths by prostate cancer decreased precipitously. So PSA screening has had a dramatic positive impact on survivability of prostate cancer. But unfortunately, it's not all a good story. So clearly, the takeaway here is that we should screen for prostate cancer using PSA. So why is not PSA screening widely recommended? And in fact, it's actually been recommended against. And that to me is very problematic. But the reason is because PSA screening by itself causes unnecessary harm. So as you're well aware, PSA, prostate-specific antigen, it's this protein that's in the prostate cells, should not be in the blood. If it's in the blood, something's going on with your prostate. The problem is 85% of the time, whatever that is not prostate cancer. It's something else. You were to brake too hard, you had a crazy Friday night, who knows, I don't want to ask. Something, you have prostate infection. And the challenge is that if you actually want to diagnose prostate cancer, you need a biopsy. And a biopsy is brutal. Transrectal ultrasound, 12 needles pressed up between the legs, through all that tissue, into the prostate. They remove some tissue, look at it, and ask the question, do you have prostate cancer? Now, if that was an extremely accurate test and it diagnosed aggressive prostate cancer well, sure, you'll go through that. It actually comes with some pretty significant chance of infection. Those infections can lead to sepsis that can be deadly. So in my mind, you don't want to do a biopsy unless you absolutely know you're going to have aggressive prostate cancer. And that's not the case when it's 85% wrong. So because of this, so the lack of specificity of the PSA test, meaning that it doesn't detect those prostate cancers that need treatment well, there's a high burden of investigation, which means that you need to do biopsies, you need to follow up with MRI. And it also detected all of this prostate cancer that we know men can die with and not of. So with a diagnosis of prostate cancer, this is a huge diagnosis. This is a big life-changing event. What do I do? Do you have it taken out? Do you have radiation? Do you have surgery? All these other options. And all of these procedures come with side effects, and all these side effects you could have avoided if you didn't know you had it in the first place. So I think the really important thing is to diagnose those prostate cancers that are likely to kill you and ignore those ones that are unlikely to kill you. And so this is probably the most sciencey slide I have, but this is really important because this slide has really guided all of prostate cancer care in the world for the last 30 years. So it's called the Gleason score. And those who've had a prostate biopsy know what Gleason score means. Frank Gleason in the mid-'80s, again, looked at a bunch of prostate biopsies, looked at the way the cells looked and whether they were organized or disorganized, and came up with a scoring system. And in this graph, we're looking at, depending on the score, 1, 2, 3, 4, or 5, how long do these individuals live? And so they have Gleason 5 cancer, they live far fewer years. And if they have a Gleason 1 cancer, virtually all of them are alive in 10 years. So what we need is a non-invasive test that does a great job of distinguishing who's a 1 and who's a 5, and everything in between. And so that's what we set out to do about 12 years ago. There's a significant need for an accurate, non-invasive test that can determine whether individuals need a biopsy based on the probability of having, a Gleason score of higher than 1. And so again, what is our goal? Our goal is to reduce overdiagnosis and overtreatment, to preserve the mortality benefits of screening, because we know it definitely improves survivorship from prostate cancer. And so how do we get there? So again, we need to reduce the number of men being diagnosed with low-grade, clinically indolent disease. So this is prostate cancer that they would die with and never know. And reduce the number of biopsies performed significantly. And on the overtreatment side, reduce or eliminate the treatment of low-grade, clinically insignificant prostate cancer. So we decided the way to do that was substantially improve the accuracy of the PSA test. And so we did that by developing a product called Clarity DX. Now, I could spend 3 hours telling you about the 12 years that we spent doing that. I'm not going to do that. I'm going to spend maybe another 10 minutes. So we had some crazy scientific ideas when we started, and I'm happy to say today we ended up with a very, very simple test that leverages AI. So we're all hearing about AI. It leverages machine learning to look at patterns in the way people present with clinically significant prostate cancer, and provide a very easy test that can serve as a reflex test to PSA. So we're still going to the doctor, we're still seeing our primary care physician, we're still getting our PSA test every year. If that PSA is elevated, instead of saying, should I get a biopsy, we're getting, let's get the Clarity DX prostate test. And this prostate test, again, is something we spent about 12 years developing, and most importantly, tested what we call prospectively. So we developed a test based on machine learning AI, but importantly, so that's great. We have some math that says we can predict prostate cancer. But we did what's called a gold standard pivotal prospective clinical trial all over the world. We talked to Health Canada. We talked to the FDA in the US. We made sure that our clinical trial design was robust. And then we assessed the ability of this Clarity DX prostate test at diagnosis, after you have a high PSA, to predict what the biopsy is going to look like. So is the biopsy going to show a Gleason score of over 1 or not? So we ran it all over Alberta. We recruited almost 1,400 men in Alberta. We recruited almost 3,500 individuals across the world. We incorporated UCLA, Johns Hopkins, even Czechia in Europe, to ask the question, does Clarity DX prostate predict what we call aggressive prostate cancer? And the answer was absolutely. It did a fantastic job. We actually got this data about 6 months ago. We were floored that a combination of a simple biochemical test and some machine learning, some AI, was able to improve upon PSA's accuracy by 300%, 3 times. This is an incredibly easy test to do. And I'll tell you a little bit more about how it's done. But if we implement this into clinical practice, and now it's available in Alberta, it will reduce unnecessary biopsies by 35%. This is huge, because this will substantially reduce the diagnosis of clinically indolent or insignificant prostate cancer. Preventing those conversations with a physician around, I have prostate cancer, should I just wait? So there's active surveillance, which if you have prostate cancer, you can decide not to get it treated. But then you get a PSA test every 6 months. You have to think about, I have cancer. You have to think about, should I get it treated? It's very difficult. In fact, almost 40% of men after 1 year of having a diagnosis and not getting it treated decide, screw it, just get it treated. So this is a burden that this test could potentially alleviate a lot. Now, if we look at other tests on the market, there are other companies that have worked and developed other tests, mostly for the American market. So I would say the closest competitor is a test called the 4K score. It was developed in New York by a colleague of ours, but it's $1,300 for a test. So in the Canadian market, that just doesn't fly. It's reimbursed in the US for almost $700. And so even as a test to incorporate in screening in the US, it's been a challenge. Because we have a simple biochemical test, our turnaround time is less than 24 hours compared to 7 or 8 days. Because our test is a lot of math, we can do math for relatively cheaper than some other tests. So we can do our price point is significantly cheaper. And so we can really scale it around the world and substantially improve the decision making around whether to get an MRI or a biopsy. So we're really excited about rolling this out. So, and I'll say, so we discovered this in my lab. In 2017, we got our first data from patients. I think it was about 300 patients where the test worked. And we said, hey, let's form a company and actually bring this test to the market. But it was really important for us. So we've had support from, we've been talking to you guys, prostate cancer survivor groups, Movember, Prostate Cancer Canada, Motorcycle Ride for Dad. We've had incredible support locally from the community, from the physicians. So it was really important for us as a group that developed this test to be able to launch it first in Alberta. So I'm happy to say 3 weeks ago we did that. The first community anywhere in the world to have access to this test is Albertans, and it was really important for us to do that. We're very proud of the fact that we did that. So now in Alberta, so any family physician in Alberta can order the test. They fill it. They basically determine. So basically, you'll get PSA screened as normal. If you have a high PSA, so over 3 nanograms per mil, you have the option of getting a repeat PSA, and at that time, you'll order the Clarity DX test. That'll cause you to have an additional test called free PSA, which is done on the same machine. You can go to any Dynalife or Alberta Precision Labs location, get your blood taken, and order the Clarity DX prostate test. The forms are available on our website at nanosticsdx.com, and we're working with Alberta Health Services to implement this test throughout the province and substantially reduce the number of unnecessary biopsies. The test form is really straightforward for both the patient and the physician to interpret. It's basically low risk, high risk. We give you your PSA score, free PSA. All of the data we put in is available on the report sheet. And if you're in the red zone, you probably want to do further investigation. Maybe get an MRI, maybe get a biopsy. If you're in the blue zone, maybe you want to think about not doing those things and waiting until next year. And we've shown through our clinical trial that if you make that decision, you can be pretty confident about the results. So again, patients can access, any Dynalife or APL location. And I'll say, so our current hurdle, so we've launched the test commercially. It's available as a private pay test. The retail price of this test is going to be $300 in Canada. We're offering it initially for $100. But obviously we don't feel very strongly about individuals who have $100 to be able to get access to the test and people who don't have, $100 not having access. So we feel very strongly that this should be, supported by the healthcare system because it definitely does improve diagnosis and definitely does reduce all of the associated costs with treatment. And so we're really keen on getting this covered by the province. But again, it's available now to Albertans for $100. So again, in this world of improved prostate cancer screening, we've been able to create a test here in Alberta that substantially improves the accuracy of PSA testing. We already knew PSA testing improved mortality. Now we've created a way to continue PSA testing, but reduce all that unnecessary harm that PSA testing was doing. And so with Clarity DX incorporating PSA screening, we can decrease the number of unnecessary biopsies by about 35%. We can decrease the diagnosis of low-grade indolent prostate cancer that doesn't need to be treated. And importantly, increase the diagnosis of high-grade aggressive prostate cancer that can definitely benefit from treatment. And so Clarity DX Prostate, again, is available commercially. We have a website. Feel free to check it out, recommend it to your younger friends. And I think, one of the things the community can do that we're working on very aggressively is getting support from the province to pay for the test. So we're going to be, and the province has been very receptive to this. So I think we're going to be looking at in the coming, months or years, to looking at its uptake in the province and looking at, whether people are doing it and whether physicians are changing their decisions to biopsy and do MRI. And I'm really optimistic that it'll be covered by the province in the next year or two. And so I guess I just want to end it in that I'm the guy talking about it, but I'm not the guy that did any of the work. So I'll accept the award. That's great. But really, all of this work was done by a huge, incredible team. We have several team members here today. So Sean Secord is here. He's a new recruit who started out actually as a fundraiser for the Motorcycle Ride for Dad, and we've become friends over the years, and he joined our team just recently. Colin Koros is here as well. He's our commercialization officer. I'll mention Leanne again as well, because she worked actually in the lab on the project. And of course, all of you who've supported us over the years and been great stakeholders in this project. And of course, everyone else who funded us. So just thanks from the bottom of my heart, Brad, to you and everybody in the team for this award. It's a real honor to join those who have received it in the past, and really appreciate all your support, and thank you so much.